Hello, everybody, and welcome to the Smart Human Podcast. Today, I had the pleasure of interviewing a colleague and friend, Dr. Myles Spar, who is a national leader in the field of men's health and author of the new book, Optimal Men's Health from Oxford University Press. He's also been on several faculty positions. He is an educator. Today, we discuss why men actually die younger, why men's health is such an issue, particularly now, and what men and the people who love men can do to help them get stronger, healthier, particularly in today's busy modern environment. So stay tuned as we discuss vitamins, men's health and longevity, ways to reduce stress, and a whole bunch of other topics to keep men healthy and strong, especially in today's modern world. Enjoy. Hello, everybody, and welcome to the Smart Human Podcast. Today, I have the pleasure of working with a friend and listening to his story, and hopefully you'll enjoy what he has to say. His name is Dr. Myles Spar. He's a medical doctor and a master's in public health. He's a leader in the field of men's health, which is quite unique. He's author of the book Optimal Men's Health from Oxford University Press, having co-edited Integrative Men's Health, also from that same publisher, Oxford. That was the textbook. He is Chief Medical Officer of Vault Health, the first national medical practice specializing in men's health. Before joining Vault in 2019, Dr. Spar was founder and CEO of Tack180, an optimal health program for men based in Los Angeles, and directed the Integrative Medicine program at Southern California's Men's Medical Group and at the Simms-Mann Health and Wellness Center at Venice Family Clinic. He has also been a clinical faculty member of the UCLA and University of Arizona Schools of Medicine and is board certified in internal medicine and in integrative medicine. Dr. Spar is chair of the American Board of Integrative Medicine and has presented internationally on integrative men's health and on issues relating to bringing integrative medicine to underserved communities. For this latter work, Dr. Spar was the recipient of the Bravewell Award for Leadership in Integrative Medicine in 2013, which I, of course, know, being in this field, was quite a remarkable honor. So thank you, Myles, for being here and sharing your time with our audience. And, how are you doing today?
I'm good. Thanks for having me. I'm so excited. It's important to talk about how our worlds come together professionally, because there's so much impact on men's health from environmental issues, and it's not really paid as much attention to. I think in general, men's health isn't. So I'm excited to talk about it. I'm excited to be here.
So here's the big question. Why should we care about men's health? I mean, why is it more important to think about men's health? Why is it important at all why should we segregate that out? And so give us some statistics and why it means so much to you as well as an educator.
Sure. Well, it's not more important, but I'd say it's as important. There's a lot of very well-deserved and needed attention on women's health, and that's been needed because a lot of studies have only been done on men, and there's been a lot of, inadequate attention paid to women's health over the years. But I feel like nowadays it kind of seems like, well, men's health is just everything that isn't women's health. And that really isn't the case. One reason, and answer your question, that we need to focus on men's health is because just like women have specific concerns related to their gender, men also do. It could be around sexual function, which is obviously specific to being a man, but it could also be about increased risk of heart disease. Men win at 9 of the top 10 causes of death in this country. 9 of the top 10. And most of those, about 80% of those, are due to preventable causes, at least in part. Men lose at those ways to prevent those problems. They lose at keeping a good, healthy weight. They lose at being physically active. We think of men as being active, but actually on average, women are more likely to be physically active than men. Men are more likely to smoke. Men are more likely to do stupid things and engage in accidents and harm themselves. And men are more likely to eat unhealthy.
Interesting.
So those are kind of so that's, we got to reach men. And I have to say, like, my big soapbox that I'm always on, that you've heard me a million times, as an integrative medicine provider, our colleagues, and us have failed really at talking to men, because we talk about wellness and these ideas that resonate with women, and they don't really resonate with men. We have to talk differently to men. So that's why I really got excited to say, okay, we need to really change how we do this, and we need to reach men. They're dying younger, they're dying of causes that are preventable, and they're not hearing our messages.
Yeah, it's interesting. I was reading some of the beginning parts of your book, which is really an excellent book. Again, it's called Optimal Men's Health, and it's available online, of course, through the Andrew Weil or Dr. Weil consumer series through Oxford. But some of the statistics you were talking about was that men live shorter lives than women on average, and that's, I think, globally. And they also have 60% higher chance of developing cancer and 40% higher chance of dying from cancer than women. So tell me why the messages aren't getting to them in terms of prevention and your thoughts on that.
Sure. Yeah, it's true. So men are dying at almost every country in the world younger than women. And for a long time, I think it was thought to just be kind of in our genes or biological. But we know that's not the case from a lot of epidemiologic studies and looking at genetic studies. It's actually due to these risk factors that men are engaging in that are harming themselves. And so it's not like it's built in hardwired that men are meant to die younger than women. And I think in terms of the cancer risk, part of that's environmental, and we need to talk about that, and those are on the rise. But a lot of it is, again, men don't really, and I'm generalizing, by the way, when I talk about men and how they respond to health messaging, I'm talking about the typical guy. And a lot of women think like a typical guy, and a lot of men don't think like a typical guy. But if we're talking about on average, men don't respond to these abstract notions of, well, you really shouldn't eat a hot dog because that could make it more likely you'll have a heart attack in like 10 years. Most guys are going to be like, yeah, whatever, 10 years, I could be hit by a truck by then, and I really want this hot dog. But if you link it to something he really cares about and say, what do you really care about? Well, I really care about sex. Okay, well, do you know that hot dogs increase plaque? And do you know that no matter what you say, the smallest artery in your body is the artery that gives blood to your erections? So you eat that hot dog, you're more likely to get plaque, and you're more likely to have problems with erections at a younger age. Suddenly, hot dog's not as
right now I see all these men sitting there looking at their hot dog going, should I? Should I not?
Right. Is it worth it?
It's a great visual. Yeah.
Right. And so I think, we need to link it to hardcore goals. That's what I always start with. And again, this applies to women as well, but especially with guys. These abstract notions of wellness, I've found, and studies have found, don't resonate as well as starting with what matters to you, not what's the matter with you, what matters to you as a guy. And then let's link any behavior change that could actually extend your life to that thing that matters to you.
So let's take a typical guy, again, typical, because I know, I don't want people to think that you're being, we're both painting every man as this type of thing. But, let's just say a guy in this country has maybe some, little overweight, little pushing around the middle, little blood pressure, maybe not as active as they'd like to be, certainly doesn't turn down a good burger here and there. What are the kinds, just an average person, let alone a man, but tell me what you would give as some recommendations and how you would frame those recommendations to kind of, really kind of win them over for sort of the top 5 best ways to get their health in order. Oh, I can't hear you. Let me see.
Hold on.
Okay.
There we go. All right. Sorry.
That's okay.
Okay. I'm back. All right. I turned my mic off to take a sip. Sorry. Of my non-caffeinated
organic coffee,
lion's mane mix. It's awesome. Okay. So the 5 kind of recommendations, I have like this men's toolkit, and people can find that in my book and find it on my website. But basically it's starting with your goals. And it really just means take a minute and figure out, what do I care about? What would better health help me do? And what would poor health get in the way of? And that could be being better at sports. It could be being a better partner or dad or son by being more patient and less kind of reactive. It could be losing that gut, like you mentioned, some of these guys are developing. It could be having more muscles, or it could be having better sex, whatever it is. Then you can look at, okay, let me talk to someone, a coach, a doctor, a nutritionist that could help me figure out what am I doing in my life that could actually be hindering that goal from a health perspective. Is it my diet isn't so great and that's making me sluggish or gain that weight? Is it that I'm not exercising? Is it that my sleep is poor? Is it that I'm not managing stress? So those are the next four. So you said five. So those are the four things you look at. You look at your goals, and then with that goal in mind, look at your diet, your exercise, your sleep, and your stress, and pick one thing. And I would add another bonus, and that's connecting with others, because guys particularly kind of suck at really developing connections, and we can talk about that later. But really starting with those and saying, what's the one lever out of those that I mentioned that's going to have the biggest impact on my goal, and only work on one thing. That's the other difference between men and women. We know women are better multitaskers in general. And so you can give women, as integrated medicine providers, we develop these beautiful plans, right? We're like, okay, you're going to start meditating and taking these supplements and change your diet, and you're going to exercise, and you're going to do a new headspace meditation, and all the, you do yoga. And some women that might work for most guys, they're just going to be like, yeah, there's just no way. But if you say, okay, we're going to start with one thing, I can give you a glimpse of this bigger plan that by 3 years from now we'll achieve. But right now we're just going to start with getting rid of sugar. Let's cut your sugar by 50% and don't do anything else till I see you next. So it's figuring out what's that one lever. And usually you need help, and that's okay. That's the other thing guys suck at, is asking for help. Get a coach. We get a coach to be better tennis players. Get a coach to work on what's the lever that will move my goal the farthest, the quickest.
Do you think men are a little bit more, like, God forbid, have a heart attack and then get it together, or, in terms of the reaction time,
Yes.
maybe more so than women? I don't know. In terms of prevention, maybe it's because anthropologically women are nesters, and they feel, it's a bigger, they feel more, they have to be around. There's a little bit more foresight in terms of prevention, perhaps, in women. Again, general.
Yeah, I think, I don't know why. That's a great thought. Maybe it is evolutionary. I mean, you're right. Women are much more able to kind of abstractly think about consequences down the road than men. I'm not sure why that is, but it's absolutely true. Most guys I see aren't that proactive. Many of them, it's a rift, I call it, like what you mentioned. They had a heart attack, or their buddy had a heart attack, or they had a scare. They just had chest pain and they went to the ER and were told it was a panic attack, but suddenly they're scared. Or their partner says, you know what, we haven't had sex in like 6 months, and you need to, I'm out of here unless something changes, because clearly you're just irritable and you're annoying, and it could be a hormonal thing, but something needs to happen to kick them into getting some attention.
What do you think about, I was going through, some of the things you wrote about different types of diets, and I get this all the time, doctor,
Yeah.
what kind of, recommendations do you make in terms of food? Do you think meat is okay? Do you think that I should be vegan, vegetarian, plant-based? Too much seafood can obviously, be a problem at this point with in terms of PCBs and contaminants. So what is the general, what do you kind of, I know it's probably specific for some patients versus others, which we're going to talk about, precision medicine sort of versus a general recommendations. But in general, what is your feeling based on the science is the most appropriate way to eat as a man?
Yeah, well, like you said, I mean, it's definitely individualized, right? For depending on that man, his risk factors, his goals, his past medical history, medications. So with that caveat, I really push these days. I think the science really favors an intermittent fasting diet for most guys, and as much plant-based as possible. I don't push people to be completely vegan, but I think like Michael Pollan's thing, eat food, so not processed food, mostly plants and not too much. And and that's old from his Omnivore's Dilemma book from many years ago, but that really still to me is very easy. Again, and I don't mean to make guys seem dumb, but with guys, you want something that's easy to understand, easy to follow, and works. So that concept regarding eating plants is easy to understand. Intermittent fasting is really easy to understand, easy to follow.
Yeah, can you explain that? Because some of the people listening may not even have heard of that terminology.
Sure. Intermittent fasting is basically when you compress the amount of hours that you're eating into a short period of time. So maybe you eat 8 hours in a 24-hour period, and then you don't eat anything for the other 16 hours. And so you'll eat, let's say you'll skip breakfast and you'll start eating at 1 p.m. and you won't eat anything after 9 p.m. And that helps your body actually detox and clear gunk out that otherwise it wouldn't if you're constantly feeding it, in a process called autophagy, AUTOPHAGY. And that's actually intermittent fasting in that way has been shown to help with blood sugar control, helps with cognition, even helps with aging. There's a book called The Longevity Diet by Walter Longo, who wrote about this. And David Perlmutter and other neurologists write about the impact of intermittent fasting on the brain and healthy brain aging. There's just a lot of good science that simple reduction in the amount of hours you're eating helps. But you can't just then say, well, I can eat whatever I want in those 8 hours or however short a time you compress your feeding window into. So you still have to eat healthy. And that's why you follow, for example, like the Michael Pollan rule I just stated. And you don't say, well, I'm going to fit everything I would have eaten into 24 hours into that 8 hour window. You actually do skip a meal basically, and you decrease your calories, because decreasing calories definitely improves longevity across all species.
And that makes sense, right? Because, and I hate to tie everything back to anthropology, but it happens to be my favorite subject. And I kind of wish I was an anthropologist in my next life, maybe. But, the idea that, for so many millions of years of evolution, we've really had to chase around to find our food. We had to, migrate to find certain plants, berries, to even get our meats that we had, or fish. And, it was almost like we had to spend about, 20 hours of our day looking for food, and we only had about 4 hours to eat it. And then we're like, oh no, now we got to start it all over again. But that's kind of how we've evolved in our genetic template to sort of match to. And so then you have modern day humans, and we have food everywhere. I mean, it's just coming out of the walls. We can get it anytime. And our body just doesn't even understand how to process, let alone, the calories, let alone the chemicals. So I think it's a really, a great recommendation. And I think also, just to make mention, that there are certain people that shouldn't do intermittent fasting, who may be, severe diabetics, type 1 diabetics that haven't had their sugars controlled. Anyone who has vasovagal or fainting episodes, you really want to make sure your pressures, you're in good enough shape to even try that. But again, as you said,
pregnant women, breastfeeding women, no teens, I don't think anyone under 18. Yeah, obviously, sure.
Yeah.
And probably you should check with your practitioner if you're on medications. Yes, absolutely. You're right.
But good point. And then also that you can actually start to close that window. And I mean, I started doing this, and you can tell me your experience on intermittent fasting, that I started at I'd get up at 7 or 8, and I'd wait an hour and eat breakfast, which is really not that much. But really, I started doing 12 to 5, 12 to 6, and, giving myself enough morning hours and enough evening hours after my last meal, to really feel like I was burning. And you also eat less. I mean, I noticed that you eat less because your stomach in a way feels like it shrinks, and you don't eat as much during that eating period. But that's just my experience. Yours too?
Yeah, absolutely. That's a great way to do it. The other way is at the other end, and that I find is really helpful, is you just stop eating after dinner. Because for many people, especially guys, but women too, it's that late night snacking that just kills the gut, or creates the gut, kills the ability to lose the gut. And so if you can, either start an hour later and then add another hour, like you mentioned, that's a great way. And by the way, the whole breakfast is the most important meal of the day was really a corporate publicity campaign. It is not from anything health. There's no proof that that's true. That's from breakfast cereal manufacturers trying to get people to eat breakfast cereal. So that is not true. But anyway, so you can certainly do that in the morning, keep making it later, but definitely stop eating after dinner, because people are sometimes really good all day long, and then they just go to pot with the pint of ice cream and chips.
No, it's true. I actually brush my teeth, so I get too lazy to have to do it twice. So I psych myself out, and I drink a lot of water so that my belly feels full. But those are that's a really good point, because a lot of people are the late night snackers. So so tell me a little bit about when it comes to supplements, and sort of say you get into your exercise regimen, or you can at least start picking that up. And you're both aerobic and maybe weightlifting as well because of muscle tone. I mean, you tell me what you recommend. What else do you consider sort of the necessary, I call it fertilizer for human health, in terms of those supplements, besides healthy, clean diet, besides clean drinking water and those kind of things? But what would you say are some kind of critical nutrients that we need to take outside perhaps of our diet, because we may not be getting it from our diet?
Yeah, sure. Yeah, like you said, it's best to get it from your diet. Nature provides things. Not only do they provide things we don't even know, but they provide them in ways that help those important things get absorbed and work better. So like you can take every component of an orange and it's not going to be as healthy as the orange because we don't even understand how they're synergized by nature and put together. But having said that, yes, certainly in our day and age, unless you're eating all organic, all wild, all grass fed, and you have a perfect detoxification system, then it's sometimes good to take supplements. So I would say, leaving aside working out for a minute, in terms of just general health, I think the thing I see the most is vitamin D and magnesium. Those are probably two of the top. Vitamin D, especially nowadays with viruses, it's really important. There are tons of studies showing if your vitamin D level is low, you're much more likely to get sicker from viruses, to be admitted to the ICU. If you have, for example, with COVID, there was just a study that came out, and about 60% of the population are low on vitamin D, and that gets worse if you live more north and in the winter. And then magnesium is really important, especially again for guys, for recovery. Magnesium is important for nerve function, but for muscle recovery and pain and inflammation, and ATP, making energy. So a lot of guys I find are low in magnesium. It can help with sleep. You can take it in the evening, around 400 milligrams. And then the next one I recommend probably most commonly is fish oil. And I'm sure you've had people on the podcast talking about that and people are sick of hearing about it, but that's because there's so much evidence that those omega-3 fatty acids do like 3 different things that are helpful for guys. They can lower bad cholesterol, they're anti-inflammatory, and they help with mood. So they can help with focus. We use them in kids for ADD sometimes before having to start meds, and they actually can help with depression. There's been some studies that they can help on their own with mild depression, or even helping your neurotransmitters be at a stronger level, because the brain uses fat as a source of fuel, and those are fats. So those are the 3 kind of cornerstones. And then I would say, then if you're talking about like male energy stuff, every culture kind of has a male energy herb. And so and they're actually really well studied. So for example, Native American and South American have maca root. Some people call it Peruvian ginseng. It's great at helping with male energy and male libido. There have been studies showing it can counter some of the sexual side effects from like Prozac and Zoloft, an antidepressant. You take like 2 or 3 grams a day. It's very safe. You can get it as a powder to put in a shake or take it as a supplement. And then that same type of herb is in Chinese medicine as ginseng, Panax ginseng, and again in Ayurvedic or ancient Indian medicine as tribulus. So you don't necessarily take all 3, but pick one of those, depending on kind of which tradition you're taking other things from. And those are all really great for that kind of male energy, libido. And then lastly, for muscle and working out, the one, we hear a lot about all the time is creatine. And there's a lot of good evidence to it. It's very safe. It's something that helps build muscle mass and helps create energy. It's part of the Krebs cycle where you make ATP and energy. And I just keep seeing good studies coming out and no damaging from creatine. So I really recommend that. And then the last one that's my favorite supplement for guys is ashwagandha, which comes from Ayurvedic medicine also, but it's an adaptogen. So it doesn't make you tired, but it helps you not feel as stressed. It kind of takes that edge off without making you go to sleep, and makes you not feel as wired and kind of anxious. So I'd say those are them. I do have a top 10 supplement guide on my website. So if guys want to read more about it, they can go to drspar.com and check them all out.
That's awesome. And, I'll interject some information about, I guess, in terms of brands. There's a lot of issues in terms of supplements, particularly Southeast Asian herbs like ashwagandha, cinnamon, boswellia, perhaps, ginseng. And even omegas, we know that there's so much watered down junk out there. It's usually buy one, get one free. And that, omegas particularly happen to be, you get what you pay for. So just a quick note on that, I would say certainly go with really vetted brands, because, the clean brands that check for heavy metals in the fish oils so that you're not getting PCBs and some contaminants, but also make sure that you're getting the right concentration, because so much of what's out there is you take one capsule and it only gives you like 300 total of EPA and DHA, which are the 2 fatty acids, and you have to take 9 of them to get to anything substantial. So remember,
and it's so confusing, just to cut you off there, because for fish oil, oh my God, it'll say on the front, 1,000 milligrams fish oil, and you have to turn it over and see, well, how much EPA and DHA, because it might be 100 EPA, 100 DHA, and you think you got 1,000 milligrams of fish oil, but we don't know if those other fish oils do anything. We know EPA and DHA do.
Exactly. And I even have the props in my office, and I actually
Right.
have people look at the bottles, tell me what they see, and then we go through all the different
Yes.
concentrations until we get to one that's like one capsule equals 1,000 of EPA plus DHA. And oh, look, it says it looks for heavy metals. And, and there are great brands out there. You just have to kind of,
Yes.
work through it. But that's a great tip, especially with the Southeast Asian herbs. They have been found to be adulterated with heavy
Yeah.
metals because there's no border control. We grow them only in those countries, and they actually get higher yield, higher payment for lead powder. Believe it or not, it's just
Oh,
absurd because it,
oh
it
my
doubles
God.
their yield in terms of payment, and no one's looking for those lead. And that's even
Yikes.
spices as well. So I
Wow.
hate to take away your moment here. I just wanted to make sure when people go through all this that there is an art to even choosing brands, but when you find them,
Yes.
you're happy, and that goes well. Let me ask you,
Yeah.
do you take a multi? Do you recommend a multi? And tell me what your thoughts are about that.
Yeah, I actually do. I take a plant-based one. There's a company, I don't know, can I mention company names or should I not?
I would hold off just
Okay,
because, I'm trying to keep this squeaky clean. I don't want people to think I
got it.
had you on just to promote the brand, but go ahead.
Okay. Yeah, I take a multi. I'm like 80, 85% plant-based. I'm not
Mhm.
100%. And so I do, get a pretty good distribution of phytochemicals and the vitamins, but I'm sure I miss things. So I do take a multivitamin that's plant-based. I think that's important to make sure it's bioavailable. I think a lot of the studies showing multivitamins don't work use really poor quality ones of really low doses. And if you really take a good quality one that's plant sourced, most likely you will absorb what you need and it'll be beneficial. And if you're already more plant based, I do think it's important to take B12 and vitamin D as well. So making sure that's in your multivitamin is a good idea.
You know what? I think to fix this, because some people are going to be like, well, which vitamins? Let's just name a bunch of them that are good companies like Claire
Sure.
Labs, Pure Encapsulations, New
Yeah.
Chapter, Gaia, Mega Food, and
Innate.
then and
Yeah.
the one
Innate
you
Naturals is the
yeah,
one
yeah.
that I
Okay.
take. Yeah.
Yeah, now I feel like I'm being fair. Okay. So tell me something about what is the difference between, just like your typical annual physical with your doctor and say an optimal health assessment, and how can an average, consumer in the U.S. Who may not have access to really great medical care or very, specific integrated physicians, for instance, what can you guide them in terms of what they ask their doctors to get in terms of ordering, just the bare
Right.
minimum that won't make their doctor roll their eyes back and flip out.
Right. Well, here's where I have to plug my book. So my book, Optimal Men's Health, has at every chapter at the end, it says, here's what you need to ask your doctor, because we don't ask our doctor enough questions. In fact, a study just came out. This was really interesting. I don't remember if I sent it to you. That showed, I think it was from Rutgers University, that showed men, first of all, men are half as likely to even go to a doctor, right? But if they do go to a doctor, they reported that they'd rather go to a male doctor than a female doctor, but they're less likely to share any vulnerabilities with a male doctor than a female doctor.
Wow.
So it's like they get there and they won't talk about their erection issues or their anger issues or their mood issues or their depression or their belly fat, because suddenly it's another guy. And that, like you said, anthropology, that evolutionary, like, ooh, me guy, he guy, have to be competitive, can't show vulnerability. Whereas with a woman, they're a little more like, yeah, my gut's a little bigger than I'd like it to be. Is there anything I can do about it? So that, having said all that, guys do need coaching on what to ask their doctor. A typical annual physical, the way it's routinely done, has actually been proven to be worthless. Literally proven to be worthless. This has been proven. This has been scientifically reviewed in JAMA, which is one of the main peer-reviewed journals of our profession, because it just checks to see is anything broken. It doesn't check is everything great. It just checks is anything broken now. Do you have diabetes? Or are you about to have a heart attack? And if not, okay, you're done. So we need to push the doctors to do a little more deep dive into what matters to me as a patient. And I need to tell you, you know what? I know you're just going to do these regular labs, but I'm really concerned because I'm not performing at my best physically, cognitively, sexually, whatever it is. And I'd like to do a little bit of deeper dive. Or my buddy just had a heart attack. I'd like to do these more advanced heart disease risk biomarkers. So it really depends on, again, what are your goals, what's your health history, what's your family history. So if you have a strong history of heart disease in your family, you got to ask for the more advanced blood tests that are called biomarkers that look for heart disease risk beyond just regular cholesterol, because regular cholesterol almost is worthless. If you're really concerned about blood sugar issues, and you should be because many guys have high blood sugar, you want to not just check blood sugar, you want to check like a hemoglobin A1C, which is an average sugar over time, not just what your sugar is in that second. If you're concerned about inflammation issues, you want inflammatory markers. If your gut isn't working, you want to ask maybe about checking into any food issues or micronutrient levels, or even a gut check to check your stool. So that's why it's good to see someone like an integrative medicine practitioner, because they will know what tests can be done to really target what your issue is and what could be optimized so you can achieve your goals better. Unfortunately, it's not our colleagues' fault. Unfortunately, most primary care docs, they're putting out fires every day. They're dealing with a ton of stuff that they haven't gotten the training in these very well proven, but not as widely known, advanced kind of, they're not, I don't like to even call them diagnostic tools. They're really health risk assessments to see what are you at risk for having down the road that we need to tweak now.
Yeah, I think that's excellent. And listen, I don't throw my colleagues under the bus. We work with lots of different colleagues and specialties,
Right.
and they've never seen an integrative course or functional medicine course.
Right.
It's really because the system is a problem, because we're not teaching
Yes.
diet, nutrition, environmental health in medical schools or in residency. So it's kind of a lack of training. And then of course they have 15 minutes to see each patient.
Exactly.
And have to manage the old stuff, not necessarily, and not having time for the new stuff. So,
Right.
again, it's an add-on value. I think I get a lot of patients that have me as a consultant to their regular doctor.
Yes.
So that we can sort of fill in the blanks a lot of times, and kind of get the extra testing that some people may not feel comfortable or feel that they have access to otherwise. And a lot of, it's interesting, a lot of these commercial labs like Quest and LabCorp actually cover some very interesting bio health assessments, like an omega check. And there's some other really interesting tests that I found no pushback in terms of insurance on. So
Interesting. Yeah.
yeah. So, I figure, if people need to start off with their primary, just to look into that. But then there's always, people like yourself and myself that people can find on the internet to help with that. So that's wonderful.
Actually, the other thing is, when going back to the men's health, just like a lot of the primary care docs aren't as well trained in integrated medicine, they're not as well trained in men's health. And a lot of issues for men can be hormone based. And many primary care docs won't think to check hormones. And if they do, they'll just check a total testosterone, which really isn't sufficient to do a full hormone analysis for guys. So you want to see a men's health specialist. And it's not just about sexual issues. Low testosterone it affects 40% of guys over 40. Almost half of guys over 40, not talking over 70. And so that can cause fatigue. It can cause moodiness. It can cause that belly fat to be more easy to accumulate. It can make it hard to gain muscle mass. Even if you don't have sexual issues, it could be a low testosterone issue. And again, many primary care docs don't really know how to investigate that. So that's why I work at Vault Health, for example. We have a national network of men's health specialists, and not to plug that, but it's just, you got to see a men's health specialist. If you have one in your community, great. If you don't, you can use something like Vault Health that has a telemedicine network of men's health specialists who know how to really drill down and say, you know what, let's look at all of your hormones that could be impacting how you feel.
I think that's wonderful, and it's important to know that these programs, these practitioners are out there, to be honest with you, because a lot of people are looking to really make a difference in their health. And in fact, when you just said, in terms of testing testosterone, free or bound testosterone, there's all these different components of testosterone in a lab that we really have to be not only what to order, but also how to interpret them. And I think that's also a tricky thing for primary cares and maybe some urologists, I'm not sure, to analyze. So it's always nice to know. So tell me a little bit about testosterone. I want to make sure we get that in, because, so many people are concerned about their sex life, their lack of libido. We know that other components affect testosterone, like opiates. Of course, I have a lot of pain patients as a rheumatologist. And we know that interferes with testosterone, same with environmental chemicals, endocrine disruptors. So give me your thoughts on not only what are the causes of some lowered testosterone as we age, which may be a little anthropological, as I like to throw in, but really what are the things in modern day living that are affecting those T levels, and what are your recommendations in general? Because I know it's a big question.
Yeah, big topic. But in general, I think, like I said, it's very prevalent, right? So we know testosterone deficiency is, like I said, about 40% of guys over 40 have it. And so the reason I say guys over 40, because that is the number one cause, is aging. So regardless of anything else, aging is the number 1, 2, and 3 cause of low T. After that, I would say stress is a big reason why we're seeing more and more low T, because we're also seeing lower sperm counts, fertility issues. And I think it is those environmental chemicals that you mentioned with xenoestrogens and stuff that I know you've talked about a lot and are in your book, as well as stress. And stress, again, it comes back to that evolutionary anthropologic kind of perspective. Just like women, when they're stressed, start having abnormal periods or maybe even stop menstruating, like marathon runners who are, that kind of thing. Men, it's the same thing. When you're under stress, whether it's real stress or perceived that you're under threat stress, your reproductive drive goes down, and it's somewhat evolutionary. You don't want to make progeny you can't protect. If there's a crisis and you're about to be killed, why would nature have you want to just be making babies you can't protect the DNA of? B, you don't have time to be worrying about, excuse the expression, getting laid. You got to survive. So you have to just focus on running and escaping and fighting, not about looking for getting sex. And so the body, as a kind of protective mechanism, knows guys will only look to have sex if that's what, and eat. So it's like, all right, let's cut down this drive to have sex so that you can focus on survival. So we're going to lower your testosterone. We're going to increase your cortisol, which is like anti-testosterone hormone. And that is a big reason I think nowadays we see low T, because that anxiety causes increased cortisol. And that's always around when it shouldn't be. And that in guys who are not managing stress adequately, not doing some kind of meditation or journaling or mindfulness or yoga or something. And that's really lowering the T, because we find young guys in their 30s, even in their late 20s, with Ts that are, low, which would be like under 300, under 350. And there's no physiologic reason. It's just because they're not managing stress well.
But, and also, so excellent points. And also, I think in your book, you talk a small amount, but a reasonably powerful amount about EMF radiation. Yeah. In terms of some of the changes where, maybe that's more for fertility issues in terms of low sperm count and low sperm quality by carrying phones in your front pocket. But the endocrine disruptions that we are around from personal care products that men use. Yep. Air quality issues, in terms of pollution, air pollution in cities and even not in cities, home air pollution from chemicals we breathe in, like phthalates and chemicals from air fresheners that we don't need. Yes. So I think your book on chapter 7, I think, was talking about how reducing those environmental chemicals makes a difference and how it's not hard to do and what you should know about it. So I actually love that chapter because, I feel like that's just an unspoken cause of low T. But too much T, am I right? Too much T can also cause problems if you go to someone who gives you, testosterone. Tell me what too much T could do if it's not managed properly.
Yeah. Well, first, let me just say that I want to put in there also that the reason it's important to get T checked is not only, like I said, for all these symptoms that I mentioned, like sexual symptoms, but low T is associated with higher risk of cardiovascular disease and actually earlier mortality. That's absolutely proven. Testosterone deficiency, there are multiple meta-analyses and multiple studies showing testosterone deficiency is associated with higher risk of metabolic syndrome and diabetes, higher risk of heart disease, higher risk of early mortality. So it's very important to get that addressed if your T is low. In terms of treatment, yes. So there are these like T clinics out there, or whatever you want to call them, where they'll just give anybody testosterone. So where I'm chief medical officer of Vault Health, we're very careful to check your levels, check your free levels, your bioavailable levels, your estrogen, all your levels, and see, are you appropriate to get T? And it's about half. It's not anywhere near 100% of the guys that come to us thinking they might have low T are actually eligible for treatment. With testosterone, we have other treatments available as well, but with testosterone. But there are clinics out there, though, that really either don't even check, or they kind of check just to write off that they checked, and they will still give you T. Or there's the guy at the gym who's just getting testosterone from who knows where, and they're also taking anabolic steroids. And so those are the people that can get really high levels, like over 1,000 nanograms per deciliter. And yeah, you're right, that can actually be dangerous. That's where you get the concepts that T is bad. That's where you get roid rage and acne and hair loss and testicles shrinking down to nothing. And man boobs. So unfortunately, then that makes a lot of guys think, oh, I don't want to go on T because it causes all those things. But no, if you just get your T to a normal level by going on testosterone, you're going to actually decrease your symptoms and decrease your risk of death. if you start taking it too high, then you will have these things that I mentioned. So all those big side effects really don't happen if your T is in the normal range.
Yeah, that's interesting. I remember having one patient who was several years ago, who was a bodybuilder, and he was actually, addicted to it. He couldn't stop taking, steroids that had testosterone in it, and he was
Yeah.
really, really getting quite ill and couldn't quite come off of it. So we can see
Yeah.
sort of these, body dysmorphic issues that can come in all packages.
Yes.
It's not just women. I'm
Right.
sure you have come across some men who are taking it too far. And so tell me,
Absolutely.
what are
Yeah.
your thoughts on that? Because that's a whole different sort of, I wouldn't say opposite, it's just a different
Yeah.
a
No, I
different
worked in
population. Yeah.
Yeah, I mean, I worked in West Hollywood for many, many years, where there are a lot of guys who are doing God knows what kind of steroids, not all prescription from the United States, and to me, they don't look good. To me, they just look lumpy and hard and abnormally large in some of their muscles. And unfortunately, it starts with celebrities or some celebrities who shall remain nameless that didn't get those bodies for those action hero movies just by eating a lot of protein and taking creatine. They just didn't. And so then there are a lot of guys who want to look like those celebrities. And the only way to do that sometimes is by juicing, so to speak. And I do think it's dangerous. It's dangerous for the liver. It's dangerous for heart disease risk. We see increased heart disease in some of these guys. It's dangerous, especially for estrogen levels, because we all convert testosterone to estrogen. And so then they end up having to take medicines to block that. And then they have to take other medicines to block testosterone being converted to other things like dihydrotestosterone. So it can cause a lot of issues in the body. And so what I would just say is, if you're doing all that stuff, talk to a doctor who won't just make you stop cold turkey. Talk to a doctor who will check what's going on with your body and help you taper off gradually, and safely, and monitoring your liver and helping you maybe take some supplements and tweak your diet to help you detox and clear things out of your system in a good way, and just slowly get off it onto a more natural way to achieve your goals.
Yeah, great point. And I also see young people that are, just high school students, college students that are taking in so much protein powders, protein shakes, protein bars, and they come in with gout. I mean,
Oh,
which is
wow.
typically like an old man's type of, that's what we think of as like the king with a turkey leg in one hand
Right,
and a,
right. And
liver in the
beer,
other and
ale in the
beer.
other.
Exactly. But
Yeah.
it's amazing. In fact, I have a relative who's a physician who called me and said, "My God, my hands are swollen." And I said, "Well, how much protein are you taking?" Because I know he does a lot of exercise, a lot of weightlifting. And it turned out he was just over too much protein, which the body is
Right.
not able to break down. And we
Right.
get this thing called gout, and it's
Yeah.
very treatable. You just have to cut back on protein because we don't actually need as much as most people think.
Correct.
Um,
Absolutely.
so you live and learn when in medicine, some really
Yes.
interesting cases, as I'm sure you're aware. Uh,
Yes.
so tell me, is there any other topics that you want to bring up? Because I certainly didn't cover the gamut of what your book covered, but anything that in particular is something that you think is worth telling an audience, and letting them hear your thoughts as not only just an integrative doctor, but as a Western trained physician. And,
Yeah.
yeah.
Thank you for that. Yeah, I mean, I think the big thing is find a provider who gets you and gets your goals. And if your provider doesn't, then find somebody else. Because, like we said, a lot of providers just aren't trained in men's health or integrative medicine and may not be able to help you go that next step. And it's okay for you to say, I'll keep that provider for when I get the flu or get, an acute illness. But that many primary care doctors are really about treating an acute problem. And I highly encourage, especially guys, to find someone they can share their health concerns with or their overall goals with, that health could help them achieve better. And find someone you can talk to and get advice from that you trust. And usually that's someone that knows more broadly about prevention, about diet, exercise, stress, sleep, and connections, and kind of feeling of why I get up in the morning, and the importance of all those things on your life and your health. So oftentimes that can involve checking hormones and cardiovascular disease risk and diabetes or metabolic risk. So find someone that can do all that, ideally someone who knows about men's health. And then don't be afraid to ask the questions. That's the biggest thing I see, especially with guys, but with women too, is guys will come in with a list that their sister, wife, mother gave them and to ask because they don't even know what to ask. And then they won't even address all the things on that list. So please, know that it's 2021. This is, we're with Me Too movement and all of the changes in what it means to be a man. It's time to evolve and understand that you can be a man and not be a jerk and actually ask for help. And that's the biggest thing. I think Brene Brown does an amazing job talking about how poor we are as men at being vulnerable and being comfortable with that. And so I just beseech men to know that they're only going to grow if they share some of their vulnerability with others and with other guys or with other women, as well as with their healthcare practitioner.
Yeah, I think it's great advice. I see most men who come in jokingly tell me that they're here because their wives or their significant other or their husbands tell them they should come in.
Yes.
And so whatever way they get in the door, I think it's really, really important, especially now. And I make this, little kind of plug in regards to coronavirus and what we're living through in such, unbelievable times right now is that, a lot of the comorbidities that men and women are, have diabetes, heart disease, kidney disease, autoimmune issues, they really put people at risk for worse reaction or response, inflammatory response to the coronavirus. And so, one of the things that we should be touting, I think all practitioners, is there's no better time than now to get your health in order because It's only going to serve you well in terms of coronavirus if you are exposed, which we all might get exposed, but in terms of your body's inflammatory reaction. And, this may not be, unfortunately, the last of our viruses that we're experiencing. So,
it won't be for sure.
Right.
Yeah.
So anything we can do as practitioners on any level to get people's comorbidities, health conditions in order, more, under control, I think now is sort of one of those, times in our history, in our lives that say, you know what, ain't a bad time than now.
Yeah, absolutely. No,
possible.
we've learned that. Yeah, and men are actually doing worse from COVID than women. Men are more likely to die of COVID. They're more likely to need intensive care unit. We don't know exactly why. We think it has to do with men's inflammatory response. We know it's different from women. Women are more likely to have autoimmune diseases than men for that same reason. There's something different about our inflammatory response, and a lot of the bad outcomes from COVID are due to an aberrant and abnormal inflammatory response. So it's especially important for guys, like you said. You got to get that foundation right before you even add supplements. Really look at your diet, your exercise, your stress management, your sleep. Those are very important for immune function.
Yeah, it's interesting. I actually saw a study that looked at men's hairlines of comorbidity of people who were dying or having worse outcomes with COVID. And they found that men that had receding hairlines, believe it or not, which may be related to either the inflammatory response or, hormone levels. Again, it was a small study, but they looked at quite a large population of the Italian patients and American patients. So, we'll see. Things are changing rapidly. We don't know exactly the answers for COVID, but we're getting closer and closer to honing in on what to work on. So, it'll be interesting to see how it keeps going in terms of our learning curve. Myles, tell me, how can people get in touch with you? How can they read about you? How can they get your book?
Right. Call Ailey's cell phone. So you can find me on my Instagram and Twitter feed is just Dr. Spar, DRSPAR. Facebook, Myles Spar, MD. Or anywhere Vault Health. I'm the chief medical officer there. That's where I'm not seeing patients on my own. I'm only helping train and make sure that we are developing this national network of men's health specialists. I'm really excited about that. And then you can get my book at Amazon. Yep, there you go. Optimal Men's Health, your guide to being healthy in order to win. And those are the ways.
That's good
Sign up for my newsletter. I got a weekly newsletter, very guy-centric. It's like 3 things. It's not this long newsletter. It's 1 social media post, 1 outside article that I curate that has important information that might be useful, and 1 blog post of the week. So
that's awesome. And young men can follow you as well. I mean, there's nothing wrong with young men, teenagers, 20-year-olds to kind of know how to take better care of themselves. I think
Yes.
that's always great to start young. So I think the women out there may want to tell their sons and their, boyfriends or what have you, or,
Yes.
so that's wonderful. So I want to thank you so much for being on, for taking the time. And I know your dog
Sure.
wants you back.
Sorry about that for all
Cue
the
the
listeners.
dog, cue the dog. But anyway, it's been such a pleasure, and you're my friend and my ally in this fight of health and
Definitely.
wellness. So I'm always looking
Yes.
to share and spotlight your work, because you're doing such excellent
Thank
work. So
you.
thank you, Dr. Myles Spar, for being on the show, and look forward to working with you and seeing you in the future.
Me too. Thank you, Ailey.
All right, you're
Take
welcome.
care.
Take care.